So this session, as has been titled, probably the shortest title, but maybe the longest of the issues, the basic services provision. And I, on behalf of IRMA, on behalf of my co-editors, I welcome you all, the panelists, as well as the attendees for this session. And of course, we have experts in this session in the domain of health, education, and the various other aspects of human development, which the speakers will dwell in their respective talks. But let me start with something which we have actually started with a book. When we talked about the issue of this pandemic and the crisis out of it, we basically talked about the several unfreedoms, and that's this audience should be aware about the approach of human development and capability, where Sen would argue that development is nothing but the expansion of freedoms. So the lack of development during a crisis situation like pandemic would be a kind of manifestation of different unfreedoms. And like freedoms are linked, unfreedoms are also linked, and a linked unfreedom might lead to catastrophe. I mean, that's that's in the book Development as Freedom, where Sen gave his personal example when he was a child, and he encountered this example, which I believe most of us know, but just for those who may not, he speaks about a gentleman called Kader Mia, who in Dhaka, during a conflict situation between Hindu and Muslim, because he being extremely poor, for his daily wage he has to venture into a Hindu dominated area, and he basically in the process get knifed and killed. So this actually gives an example when there is a curfew kind of situation, I mean, which was almost, you can correlate to the lockdown situation during COVID, and when there is an unfreedom of mobility, then obviously those who have more economic unfreedom, they are going to be the sufferers. So like political unfreedom, when coupled with economic unfreedom, can also take away somebody's life, and that exactly had happened during this this crisis situation, a crisis situation post pandemic, both in the first and second wave we have witnessed. So from the morning, I mean, if we some of us who have listened to our speakers, I mean, we always, I mean, like Professor Ravi Srivastava was mentioning, that one need to even if to be quarantined, one has to afford to be quarantined, in the sense everybody may not able to afford to do that. I mean, so the Lakshman Rekha, what the Prime Minister said, he was mentioning, was something which is unrealistic for many sections of the people, which unfortunately the government didn't realize even before announcing a lockdown of, I mean, which all the speakers probably echoed that a 4-hour grace period of lockdown in a country like India is such a crime. So the point that that as institutions, as we have done in this book, where we looked at the institutions, governance, and those aspects, I mean, one would obviously would see basically in this kind of situation, in normal situation as well as in a crisis situation, the institutions are made to basically see that the person who is in the last in the line need to be attended. I mean, and that more so in a crisis situation. But unfortunately, that doesn't happen. I mean, we create those political and social institutions to counter or to balance, something like where you say $1, one value. I mean, those who would be rich would be privileged and connected and will have a greater social, political, and economic network to sustain. Then obviously these institutions are meant to actually take care of the underprivileged. But that has not this book through its various chapters, particularly in the section which we are talking the basic services. I will not go into this chapter because particularly I will not go into the issues of health and education, which already we have experts in health, as well as Dr. Saswati is also here, which chapter is on education. I will just make one point that how these deprivations happen in multiple layers. That's basically, I am again taking from the chapter which I co-authored with my PhD student, Saidul. That chapter we talk about the triple deprivation of the women in the chapter number 10, where we talk about non-COVID healthcare at the time of COVID. So when there is an out-of-pocket expenditure because of ill health, and when the woman actually is the sufferer, they actually face multiple unfreedoms which I spoke about. When there is no transportation available, obviously women will not be able to, in general is deprived. That's what we came to know while interviewing in a government hospital, that the women footfall in the hospital has particularly declined during the lockdown or the post-COVID days. So they are deprived. Those who study poverty, we know that the intra-household distribution of poverty between male and female is different. Then when the female would be at the receiving end, they would be eating the least in the last, and those kind of issues. And also, because male coming to the native, because of the loss of job they had in their destination, they came back to their respective homes. So the jobs which are available for women, particularly in agriculture, those are also taken over by men during those times. And also the houses of the where the households went through this health crisis and they had to mortgage their assets, it is again the women. It is through the interviews of the various patients and their caretakers, we came to know that it is the women assets, particularly the ornaments and other kinds of valuables of the women, those were basically mortgaged, not the assets of the men. So this is again a story of deprivation which happens in multiple layers, and then it basically gets aggravated. These injustices are already there in our society as kind of structural inequalities, but then, as all of our speakers today has highlighted the point, that this is something which got aggravated during the time of COVID. With this initial remark, let me introduce our panel to the audience here. So our first speaker, I will follow the pattern in the first session where I will introduce each one of you, and then I will hand over the stage to you. The first speaker, we have Professor Sachidanand Sinha, who is a social geographer at Center for Study for Regional Development at the JNU New Delhi. He was chairperson of the center during 2017-19 and also coordinator of the UGC Center for Advanced Studies in Geography. He works in the area of access to social amenities, particularly education, healthcare, housing, and related development issues, with special reference to socially deprived population. The one I was talking about, the vulnerable groups, women, aged, and physically challenged in India. He has published 5 books and over 50 articles in reputed journals and guided over 30 doctoral and 75 MPhil research theses. He is in the editorial boards of several international journals. He has discharged responsibilities in various government positions, both at the central and state level. For instance, he was a member of the working group of the 11th plan of UGC working group for the development of model college in educationally backward districts of India under the Ministry of Minority Affairs and Ministry of Social Justice and Empowerment. During 2010-11, he served as the consultant to the Punjab Governance Reform Commission and later on as the chief advisor of the core group for development of school textbooks in social sciences for the government of Rajasthan and SCERT Chhattisgarh. He has also served as the advisor to the Central Advisory Board of Education Subcommittee on Improving Government Schools in India in 2015-16 and Niti Aayog Working Group on Vision 2030 Government of Punjab. Over to you, Professor Sachidanand. The stage is yours. Thank you.
Thank you. Thank you, Dr. Hippu. And this was a very liberal and introduction. I don't deserve that. I thought I don't think I have any special expertise on education, the area that I try working on. But as a geographer, our effort, and Shashwati is also one of the geographers here, and who has been working extensively on remote areas and basically looking at as to what is the locational advantages and disadvantages of schooling infrastructure. We all know that one of the greatest challenges that we have right now is to look at the fact that there have been a few million school children who dropped out during the pandemic. And the reports can vary from one estimate to another, but we have sufficient evidences to say that even if they may not have dropped out, and as somebody says, who has a very long experience of working in the area of education, that particularly, in case of school education, nobody drops out. In fact, they are made to drop out, or they are kicked out. That's the right kind of term that he uses. And we have evidences of this kind. So the pandemic situation, which led to closure of schools, has to be seen in a certain perspective. That's the point number one that I would like to present before you. Particularly in the light of the fact that we have the new education policy 2020. And one of the aspects that the new education policy talks about, not so directly, but in a certain way, that it's going to address the question of quality. It's going to really further strengthen the infrastructural supplies, and so on and so forth. But it also at the same time talks about rationalization of the schools and rationalization of teachers. So there are two kinds of things which I would like to share with you. One, of course, is the fact that what was the what is the evidence that we have from whatever surveys that people have conducted in different parts of the country, whether the learning process and the teaching process through whatever intervention of technology, internet, and the smartphones and so on and so forth, makes it very clear that in rural areas particularly, not more than 8% of children in the age group of 6 to 14 ever were found to be engaged in any kind of a regular classroom engagement. We all know that there were difficulties with the data card, and there were difficulties with internet and so on and so forth. No matter how much we laud the efforts of the ICT or the technology that is there to provide an interface in the process of learning, particularly in the schooling sector. We all know that in our own respective universities, in spite of the fact that we had better access to infrastructure, relatively better access to infrastructure. It was certainly not the same as, you have children in schools, particularly in the rural areas. And yet, our program, our teaching and learning processes suffered tremendous handicaps were there, not because only of the internet connectivity, but also because, we were also trying to learn as to how do we really, what processes should we adopt so that, the learning process doesn't suffer as much as it did. In universities, the stories were different. In colleges, the stories were different. But in early stages of school education, particularly in the elementary levels, the evidences are that the learning processes, took a back seat, and there was a tremendous decline in the learning abilities, which one can say, well, particularly in the context of school learning assessments, that are there, brought in by different agencies, including NCERT, that learning abilities or the learning levels have been poor, particularly in the government schools, particularly among sections of population that Hippu was talking about, the disadvantaged groups of people who in fact have, in various assessments, they say that, well, the people, the number of children who are outside the ambit of the school system has declined tremendously, and that, there are not more than 4 to 8% of children outside the school system, which, in fact, the ground reality doesn't support that. They may be enrolled, but they may not be attending schools on a regular basis. Even prior to the pandemic, and particularly during the pandemic when the teachers were not around, when the schools were closed down, I think, the extent of deprivation that children had to undergo was tremendous. What it really means, if everything goes on well, schools reopen, are we really going to see them all back in a school? Evidences are, the past evidences are that, that will not happen, or that perhaps, seldom happens. Once you discontinue your education, and you sit idle for such a long period of time, there are evidences from field work, where children, particularly in the age group of 10 to 14, they became part and parcel of the labor market. They started participating in labor force and brought in some kind of a money, particularly when the households were in a deep crisis because of declining employment, because of loss of jobs. All that, I think, the book must have already covered to a very, very great extent. I have not had the opportunity of having seen the book, but I believe, all these issues of employment and all that could have been addressed there in a much more comprehensive manner. The point that I would like to, a very brief point, that I would like to mention here, and rather wind up my very brief presentation. And I must also apologize because, I'll have to leave this meeting early for reason being that I have to go somewhere, which is a very recent development, so I'll have to go. So excuse me for that, if I'm not there to answer to some of the queries. But, the aspect that I wanted to emphasize is, and that is where, I was talking about the NEP 2020, which never saw the kind of debate in the parliament that it should have. The fact that, it was introduced by the government during the time when the second wave was already around the corner, or maybe it was already there, and the whole country was facing that, perhaps the whole world. And yet, the government chose to, in fact, introduce it. and not only introduce it, but also unfold the policy framework in a certain manner, which may have begun even before that. Say for example, the school closures, since we are talking about the loss of education, loss of learning due to school closure during the pandemic. I think, it's not just the pandemic which is a cause of our concern. Of course it is, but, the story is much bigger. That is something, that our friend Surajit was trying to also point out where it's coming from. I think, it really doesn't require much of an intelligence from our part, especially in case of education, as to where it's coming from. It's certainly coming from, the kind of developments that we have seen in the last 70 years. And I'm a profound believer of the fact that, whatever may have been the lacuna, drawbacks, inadequacies with our educational system, that surely needs to be addressed. But it was this education system which enabled enormous amount of social and economic mobility across the length and breadth of this country. And that perhaps has really gone a long way in challenging the power structure, because in the present circumstances or ever before, education, knowledge perhaps is one such important attribute which can change the power structure, whether or not you have access to the kind of resources, land, or maybe financial resources. So therefore, I have my considered opinion on the text that is there, 64 pages of text, and another 500 pages of the draft policy makes me feel, and I'm quite positive about the fact that, the new education policy is going to, in fact, create an architecture for a handful of people who, in fact, are the propertied classes, are the people who could perhaps benefit from privatization of education, are the people who, in fact, saw that their hegemony in the society had declined as a consequence of whatever democratic processes that were unfolding on the ground. And of course, education played a very, very important role. That's where, one has to look at, economists may look at the question of school closure from the point of view of the economics of it, that whether we can run a school when the number of children are so few. It's true that, there are demographic changes. There are also mobilities from rural to urban areas, and therefore the number of children who are perhaps, available to go to school, they could be fewer in number. But, if we look at the policy, it says, it quotes a certain kind of a number. I don't exactly recall, but it's 30 about, or maybe even less. That if the school had less than 30 students enrolled, then, such a school should be merged with another. As a geographer, I'm fully aware that if we go by the average size of rural habitations, and I'm talking about habitations, and I'm not talking of villages, because Indian villages are made up of so many habitations, and some of these habitations could be far and wide, spaced in a manner that a child may find it very difficult, particularly in difficult terrains that Shashwati would be talking about, to in fact utilize the educational infrastructure. Maybe it's there in the village, but still far, for a child of 6 or 7 or 8 years, to travel that distance in difficult circumstances. But if I were to perhaps take a look at 34% of Indian villages, to about 38%, the numbers, the number that I'm quoting is based on 2011 census. and this is based on all India kind of an averages. Of course, there are geographical variations. Then, what we are expecting is that an average Indian village would not have children in that particular age group, which is below 14, in excess of something like 45 to 50. If you go by, the age structure, the best of the age structure that you will have in an average Indian villages would perhaps, result into a kind of number which would be of 40 to 45 to 50 children. And therefore, closing down schools itself, in the name of school rationalization raises questions. We have RTE. We honor right to education. But we really do not honor the fact that it is within the RTE that you have the provision that the neighborhood schooling is an essential commitment of the state. It started as a directive principles of the state policy, but today it stands as a commitment, as a right to education. And therefore, if we go and try to probe into the tribal areas, there was a project, which was being run by the Niti Aayog Saath project, which started working even before the new education policy was introduced or even adopted. The schools had begun to be closed down, and there is some kind of a report which one of my colleagues from the Education Center in Zakir Hussain Center for Educational Studies has prepared on what are the consequences of school closure. And we know that, there have been a few hundred schools in different states, Rajasthan, Udice, Jharkhand. Madhya Pradesh is now very much, thinking of closing down nearly about 1 lakh schools of all stages of school education and leaving out only about a few thousand, from out of nearly about 125 lakh of schools that the state government runs. In years to come, this number would come down to something like about 15,000 or so. The place where you all are sitting, maybe where this IRMA meeting is happening, the state of Andhra Pradesh, Telangana, too have been following this policy of school closure. And when we talk about the degree or the extent of deprivation, then the extent of deprivation in a tribal hamlet, which is far more interspersed and smaller in terms of the composition of population, in terms of the population size, where they will have to negotiate distances across, the forest areas and so on and so forth, even though the schools or maybe their habitations could be connected by roads, even though that therefore there could be arrangements for taking children from one school, from one village to the school, even linking a series of through transport, some kind of a transport network. And I recently had my experience in the hills of Uttaranchal. When the schools opened in March, I was there for nearly about 40 days. And I saw that the school attendance had dropped significantly, precisely because of the fact that some, and most often, the children missed the buses, although it was all provided by the state, the rent was being paid by the state government and so on and so forth. So if we are talking about the fact that the centrality of learning of children, particularly in the formative stages, has to be addressed in a manner that it is the spirit of the RTE really tries to, in fact, bring about the neighborhood schooling. And most of these neighborhood schoolings, we have to understand, as the Udice data says, that close to about 1/3 of India's primary and upper primary schools are single teacher schools. One could perhaps say that, there can be multi-grade teaching and so on and so forth. I have my strong reservations. because at the early formative stages of multi-grade teaching perhaps really doesn't work. On the contrary, you have situations where, the average number of children, average number of teachers in a primary school works out to be close to about 6.5 to 8 in a state where I worked as an advisor to the government in Punjab. This was about 2010 or so. The gap that we have in terms of the provision, in terms of the provisioning of infrastructure, education infrastructure, where, it's not only that there are single teacher schools, but, the percentage of schools which have under 3 teachers at the primary level and less than 3 teachers also at the upper primary level is huge. Instead of addressing these questions, also in the light of the fact that, there are various kinds of statements which are being made by the state governments that they would be employing teachers. I think, employment of teachers has taken a back seat rather than, the annual attrition of the teaching staff has taken over, leading to a perpetual shortage of teachers and the learning process. In the light of these facts, if we all agree that, these are the ground, this is what the ground reality is, what could have been done during the time of the pandemic, and what needs to be done after the pandemic. If we perhaps take a look at some of the experiences of some of the NGOs, and one such NGO that I'm in touch with, working in the border areas of Udice and Jharkhand, particularly among the tribal communities, the results are far more encouraging. That in spite of the lockdown, their volunteers met children in street corners in a group of 5, group of 7, depending upon how much the community was in a position to prepare to, in fact, spare children for this work. And if one were to perhaps compare the outcomes, the data is still being, but whatever little data that I have seen gives me a very encouraging kind of a picture that even during the pandemic, if the state wanted, if the governance process could have paid some attention, that, you cannot really suspend, no matter what is the crisis that you have. You have to keep in touch. You have to keep children in touch. You have to keep them, engaged in one way or the other. The experiences of this particular, and they have their videos on YouTube and all that. I'm basically talking about an organization called Inspire, which in fact has worked in these areas. And the results were very, very encouraging. In fact, the creativity, they were not into formal kind of a classroom kind of situation, but to really help them, become creative, become, far more responsive, talking, playing games, and keeping them away from the labor market. They really did a wonderful job. At least, I'm witness to 2 or 3 such localities myself. So the opportunities were there for the state, for the institutional process to be put in motion, to in fact think alternatively, in order that, the learning processes of children, such young children in the age group of 6 to 14, and that's the age group that I'm really talking about. And it is not only restricted to rural areas, but I'm concentrating on the rural areas. If you look into the statistics that has been presented by Jean Drez and his team, and there is a booklet, a small booklet called Locked Out, then you will find that, in the urban areas, the learning outcomes were had dropped significantly than it did in the rural areas. So therefore, it's not rural versus urban. Of course, urban were far more better endowed and rural was far less endowed. But had we really, and it was certainly the state governments and of course the central government, the policy vacuum that we really saw during the pandemic period on various fronts, particularly on education. Closing down a school was a very simple choice. But you know, इसका खामियाजा तो भरना पड़ेगा. आने वाले दिनों में ये देखना पड़ेगा कि इससे कितना नुकसान हुआ है. ये 200 या 250 मिलियन चिल्ड्रन का सवाल ही नहीं है. ये पूरे जनरेशन का सवाल है जिसको आप डिप्राइव करते हो. और जब आप डिप्राइव करते हो तो उसका मतलब क्या होता है? मतलब यही होता है कि वो चीप लेबर के तौर पे आपके सामने होगा. उसके लिए और कोई दूसरा चारा नहीं होगा. जो काम घर की महिला करती थी वहां छोटे बच्चे भी काम करेंगे उसके साथ. The phase, the ages, you know, that we fought as a democracy to in fact fight the bonded labor within the patron-client caste relationship seems to be making a return. And it has made a return precisely because, you know, that meager, whatever number of days of assured employment that really brought more significant changes in the rural areas in terms of the wage rates and so on and so forth, in terms of shortage of cheap labor to work on the farms. Therefore, the narrative is very clear. The narrative is that I see, and I don't want to mince my words, that one of the most important purposes of this new education policy prior to the pandemic and after the pandemic, and pandemic has only enabled it to arrive at some kind of success in their agenda, whosoever were the architects of this, is to create a situation where, you know, the social, economic and political mobility that our democracy was in a position to, whatever manner it could provide, that process could be slowed down. And it has significantly slowed down because of the pandemic. It will slow down also because of the kind of an architecture of school and higher education that the NEP is talking about. What else can we really make out of the NEP? When it says, contrary to the provisions of the Right to Education Act, that there will be census test at class 3rd, at class 5th, at class 7th, and so on and so forth. Every test would mean that a handful of children, maybe whatever number of children, would drop out, would not perform so well. And then, you know, you will bring in the ICT and say, well, you know, you could perhaps benefit from distance education. You could benefit from open schools. So there is already a kind of an architecture that we have been living in, that for every class there is an education, a kind of a schooling segment. You know, for the central government employees, you know, you have the central schools, you have model schools, you have pace trend-setting schools, you have Navodaya Vidyalayas, you have army schools, you have all kinds of schools for every class and set of employees, but we don't have a public schooling system in this country. We have allowed that to in fact die out. It's not that the public education system, funded by the Department of Education, funded by the tribal ministries, funded by various other agencies of the government, were not functioning, and most of us are products of such public education only. But when you have these kind of tests, and I'm bringing in the NEP, then the intention is very clear. And when you bring in the skill training, which in fact is very much needed, but then when you really look at it in the context of the Indian caste society, may not be so much visible in Bengal in certain parts of the country, but particularly in the Hindi-speaking belt, the so-called from Rajasthan to Bihar, Madhya Pradesh inclusive, the kind of correspondence that you see between the caste and occupation is likely to get reinforced, and therefore, it rather contains a much greater dangerous signal for us in years to come. So my final point, and this is where I would like to end. I think I've taken 2 minutes more than the time allotted to me. I self-allotted myself about 20 minutes. I've exceeded that, is that we really got to take a look at the new education policy from close quarters. And then, we got to really see as to how we can, and what needs to be done, particularly in the schooling sector, particularly in the early schooling sector. And how can we rather contest, through our own academic writings and so on and so forth, contest the fact that, school closure is not a good idea, that we got to really be sensitive about the fact that any amount of provisioning in a state which really doesn't spend more than 3% of the GDP on education needs to be enhanced. A commitment on paper has been going on for fairly long. We've got to really transcend that and bring that on the ground. Thank you very much for your patient hearing. Thank you very much.
Thank you, Professor Sachidanand. Yes, so the floor is open for some quick questions if anybody has, because he would not be available at the end of the session, as I already expressed. So
yeah, I'm sorry, I'll have to go because, I'm going to retire, so I'm looking for a house. So there is somebody who has promised me a house, so I have to go and see that person today.
Sure, sir.
I'm so sorry. Yeah. Otherwise, I would have loved to stay.
Yeah. So as we all sort of listened to him for the last 20-25 minutes. Basically in the book, I would say, what we have written about the book about, as I was mentioning in my initial remark, the all very different and multiple Kadar Miyas. Those, the rural population, the migrant workers, the domestic workers, the slum dwellers, which we discussed in different chapters, and people who are deprived. The education situation in the pandemic, what we spoke about, those who had the capacity, both technological, financial, social, the affordability they had, the compatibility they had, they could actually sail through this, the dark days of the pandemic. But those who didn't have those capacity, and they actually faced the brunt of it. And of course, he did. I learned a lot when he spoke about how the NEP is against a kind of indirectly against the neighborhood schooling, and it is basically promoting the closure of schools, and a policy which was rushed through during the pandemic, and which actually contradicting our right to education, which actually talks about neighborhood schooling. This is something which all of us has to ponder about. And as he ended his, in respective roles, we have to write, speak, and do our best to counter this as much as possible. Yeah. So any questions, please? Yeah. Yeah. So that is Professor Sasuti. Yeah, you have a question, please.
First of all, thank you so much, sir. After a long time, I'm listening to you. And it is always enriching to listen to sir, because he was my PhD supervisor as well. And always I learned from sir a lot. So some of the things, it is not a question, because I know what he's talking about, because I have listened to him before as well. As he was talking about this Jharkhand Odisha border, that particular NGO is working. And if you can highlight little more about that particular initiative, because I work in some kinds of places like this, so I will be glad to know little bit more about it. If you can highlight little more about that particular initiative.
Yeah, we have plenty of these examples. I'm not particularly referring to Inspire, is an organization which in fact is working in several districts, And then at the panchayat level, in collaboration with the state governments and with the collaboration with the panchayat leaders, they have set up infrastructure at the panchayat level, which is a self-sustaining model. One has to go and visit some of these places in consultation with the people in Inspire, which in fact works all over the country. I had my interaction with them only early this year, and this is how they shared some information with me, and they have some field work going on, and the results are still coming in. So it's too premature for me to in fact reflect upon the results, because they really need analysis, and they need to be in fact corroborated through some kind of a field visit, which I plan to do during the rainy season, because that will be the time then when the weather will be somewhat better, and I hope I will be in a position to spend some time out there. But whatever booklets that I and my interaction with the people who worked there tells me is that they were in a position to, with the assistance and in a way an indirect approval of the district authorities, even during the time when there was a complete lockdown. They did continue in small groups, meeting children at their residences, keeping in touch with them through phones, talking to them. In fact, the work that I was referring to is that, both in urban and rural areas, the Chatterjee's team, which is not a very big sample, but nevertheless, even in urban areas, the children had no access to the school teacher, and that they did not follow the instructions online. Here, we saw a very different kind of arrangement where they were not really particularly talking about the curriculum, but they wanted to keep some kind of engagement through games, through creative activities, through performing arts, where an individual could perform, maybe just recite a poetry and so on and so forth, so multiple ways, and there was no such, what you can call it, a definite package of activities. It was left to the local coordinator. And these were done by young people who in fact had spare time for whatever time that they could put in. And according to my interaction with the field workers, that the outcomes are very, very encouraging. In fact, the learning process is continued, because it's not that you have to really learn ABC from the textbook. The learning can perhaps take multiple dimensions, and there is no one definite way of keeping alive the spirit of inquiry or the thirst for knowing a little more. So this is in Singhbhum, the Purvi and Pashchimi Singhbhum, and the adjoining districts and they have shared these statistics with me, which I'm still trying to match with the Udice data, and maybe this will be in a month or two. I'll be in a position to in fact bring about some kind of a narrative on the basis of what they have done. But before that, I'll have to also visit the field. We have plenty of such examples also in Bengal of some local initiatives. In Uttaranchal, I saw 40 days that I spent there. I saw a lady, holding a class, of a group of nearly about 8 to 9 children under a tree, and the opposition came from the village elders that you are exposing our children to the infection, although there was no infection in the village at all. It's an isolated village, and so she had to withdraw. So therefore, it's a whole complex process, which we need to really understand. And I was particularly talking about, because these are episodes of experiences which could be episodic, but what I need to really emphasize that it's not just a sudden episode. It's a kind of a process which in fact is being supported by a certain kind of a policy, which perhaps would see that enrollment goes up, but the learning doesn't happen. So you can have a situation, the way NSS looks at it, is that whether you are enrolled or you are attending. So there is a lot of difference between the enrolled and the attending, and we all know that the school never strikes off the name unless and until the school living certificate is obtained. Until then, the name stays where it is, for variety of reasons, because then the block education officer would be after the lives of the teacher. So there is a lot that we need to really look at, and these were just a few instances to emphasize that the state needed to do much more than what it did, because closing down a school was certainly not good enough. And okay, closing down a school, but then what is an alternative that we have? I don't see that there was any kind of a roadmap for such a long period of pandemic that the government was seen to be engaged with. If they are NCRT and SCRT, they were only preparing those kinds of modules which could be perhaps telecasted on TV, and which could perhaps be transmitted to the children through whatever means. And I have the statistics in front of me, which says that not even 34% of the children perhaps ever received regular homework from the teachers in urban areas. So therefore, and this is a small sample, that I'm really talking about. The situation in rural areas is still worse. And so if the child doesn't have an interaction with the teacher, is not in regular touch with the teacher, is not doing the work that comes in the form of homework, and doing homework, particularly in households where parents or maybe other members of the households are not so literate, cannot perhaps extend any help. The child perhaps is left to her own, and therefore there is absolutely nothing that is happening. So the children have whiled away the time spent, or time budgeting kind of exercise, if somebody may carry it out, which would perhaps be very interesting for us to see. They just whiled away time, sitting inside the house, or maybe playing with their peers outside. But the education certainly took a backseat, a very serious backseat. And my concern is whether we will be in a position to get so many of them who have dropped out back into the fold of the education system.
Yeah, thank you, sir. Thank you very much. To bring in such emphatic way the role of NGOs and the contribution in this space, in the time of crisis. Okay, extending the discussion in the same spirit, I now invite Dr. Sashwati to the floor. I'll have a brief introduction of her before she starts. She is a faculty at the School of Education in Chatterjee University, which is situated in Bangalore. A geographer by academic training, she has work experience from more than 20 years, largely in teaching and research. She holds a PhD from JNU. She has keen interest in research on schooling process in challenging locations, educational leadership, educational governance, policy implementation, intervention design, monitoring and evaluation. She was earlier associated with the Institute of Social and Economic Change, Bangalore, for the midterm evaluation of the 11th five-year plan. Her fervor for research is visible through several publications that include chapters in books, articles, journal, magazines, and popular social media. Most of her publications are based on a primary research on schooling challenges. That's what she's very interested in. And quite interestingly, in such locations like natural hazard prone areas and the context-specific challenges associated with integration of national policies, such as places like fringe areas of desert, remote locations of Uttarakhand, and armed conflict areas of Chhattisgarh. She is associated with a few academic journals as advisors and reviewers. She is also associated with a few social initiatives in India where she mainly works for children from underprivileged background. Also, one of the authors in this edited volume, which she co-authored a chapter on education related with education. Over to Dr. Sasu.
Thank you, Professor Hippo. And it is my honor to be in this kind of panel where Professor Sina is there, and it is my honor to be here along with other eminent scholars here. I'll not talk much about only the chapter because it was written almost 1 year back, and really thankful to all the editors who put lot of effort. Somadeep, Indranil, Hipu, and Kinshuk Sarkar, all are professors in different areas, are very busy people, and it was very a pleasure, much pleasure, and good learning from all the other authors as well. What I would start talking about where Professor Sachidanand Sinha was also highlighting to some extent. And I'll give a quick rationale why I took this as one issue in as a contribution to this book. My chapter name is Impact of Pandemic on School Education in India, Generations at Risk. As Professor Sina was also highlighting, it is not a just few children, few area, few localities. It is, we can see when the schools are disrupted, schools are closed, uh, we can see what happens. The background is that I started working in some areas which are remotely located, also partially or fully hazard prone, especially natural hazard prone, as Professor Hipu was giving the introduction. I worked in couple of areas, including the desert area, fringe areas of desert, as well as some of the areas like Uttarakhand and also Bastar region, which is armed conflict area. And I have seen that disruption happens often. It is not necessarily only because of certain things which is impacting directly the school building. It might be because of some social access, physical access, as well as economic access. And especially in those hazard prone areas, there is a seasonality of the character of school disruption. And if one child is not going to school for couple of months because there is an access issue, especially during these hazard areas, flood prone areas, etc., what happens is continuously for a year, uh, for years together, they are not going to school for almost 2 to 3 months to 4 months time, for various reasons, not only because of school building getting affected, because the school building sometimes is used for different kind of shelter. Sometimes there is a livelihood issue at the home front. Sometimes it is because of the physical access to the school. Maybe the school road is already not in a good condition, therefore they can't access the school. So this kind of interaction happens, and because of that, what happens ultimately in the 9th or 10th standard, when the child reaches, he or she starts failing, and the failure gives a kind of very different kind of situation altogether, because there is a family pressure, etc., and finally they drop out. And when as a vicious cycle, I can see in the same kind of areas there is a lack of local teachers. And during this pandemic, the pandemic started in March 2020. I wrote this chapter along with one of my students in our university, who is also associated with his own school in Bhandara in Maharashtra. Is Roshan Samuel. Probably he couldn't join today. So I was really worried about this whole pandemic situation and certain school closure because of multiple different reasons. Number one, that if the schools are closed, probably school is the only source for many of the children for their midday meal, which is a major meal for them. Second is for their education also, that is the main source for them, because they don't have literate parents at home. Third thing is, if the school is closed for unlimited period of time, probably they will not be in touch with any kind of formal education, and they will probably lose their kind of motivation for education further, and finally silently excluded. So given this kind of situation, I was worried about what to do and how to do. And just before this pandemic, I finished my last phase of my earlier research, which was happening in Barmer. It was a very remote area of Barmer I was working on. And I was thinking, if the schools are closed, there is nothing with those children, those set of children with whom I was working. So my chapter is mainly highlighting on two different arena. One is what is the global situation and what is the Indian situation. And Indian situation, if you look at it, I started talking about the current situation, which is already problematic, and there are multiple different children who are not in a good shape in terms of their health, hygiene, etc. And because of that, their education is already getting affected. In addition to that, the enhanced vulnerability of the children during this pandemic. And if we look at the enhanced vulnerability, there is a kind of character of this kind of vulnerability. One is, you might have seen the migrant laborers children who are also traveling, and these migrant laborers children are there across India everywhere, and there is different kind of migrant laborers children. I'll come to that point little later. There are COVID orphans and children with single parents. And some of the reports were showing that more than 10,000, this last year's data, more than 10,000 children already officially were recorded with single parent or no parents at all after the COVID, especially after the second wave, the things might have drastically changed and it might be more in number. So another problem was increased malnutrition. Because the midday meal was stopped, school was no more there. The only source of their one meal in a day, it was completely nowhere. Fourth one was vulnerability due to child trafficking, and it was happening across the country again. All the data are not being shown in the media, but it was happening. And I had couple of conversations with my some of my students who were earlier here, and they are working in the field. And it was also happening in the form of child marriage. It was not only child trafficking, it was in the form of child marriage. There was some kind of negotiations, and people are getting money, and all kinds of things were going on. It is, I can't show you the data because I was having the conversation and I was getting really panicked about what is going on. And the fifth is vulnerability caused by disruption in the schooling itself, because they don't have any social space where they can share their anxiety, etc. So I will quickly share my screen for a while to show a particular thing which I'd like to show you. Is my screen visible? Is my screen visible?
Yes, yes.
Okay, thank you. So I was thinking that what will be the situation for the children, and this is a graph which is also included in my chapter. If you look at this preschool 1, 2, 3, 4, 5, 6, 7, 8 to 12 grade, I have just noted down the grades. And if you look at March 2020, when the schools first became completely, it was closed. And school closure, actually it was very disappointing to me to see that school closure equivalent to education closure, that is formal education was closed. And it was, I was visualizing like is it a like a cupboard that you are closing it, locking it, and therefore there is no education, no formal education happening. So it I was thinking that if March 2020 one child is finishing this first grade, March 2021 the child is supposed to finish second grade, March 2022 in the third grade, and during May, June 2022, the child will move to fourth grade. Right now, we are at this kind of phase. So the child who has not studied second and third grade is directly getting into the fourth grade if we go as per the RT norm, which says that age appropriate class. And age appropriate class means the first grade child who finished first grade in March 2020, the person is going to be in fourth grade right now. Is the child capable of dealing with fourth grade syllabus? Similarly, 8th grade child is going to be in the 11th grade, that means 10th pass and then 11th grade. Similarly, you can see that all these kinds of shifts is a major problem. Number one, not only for the formal education, in between this entire pandemic time, children had tremendous mental health issues also, because they are seeing their relatives, they're seeing their close people who are no more, or there are livelihood issues, there are all kinds of things going on, all kinds of anxiety going on. It is not merely the formal education who is taking care of their mental health issues, etc. At the same time, many children are getting sold off in the form of child labor. They are getting trafficked, they are getting married, especially the girl children. And given this kind of situation, I was thinking that what is the kind of vulnerability, and you can see I was just doing a thinking about it, and we had a brainstorming on this, what might be the possibility that relatively easier to manage for this preschool to third grade. Probably you can just start doing something in terms of the formal education, but again, the mental health issues, probably Dr. Shavana is there, who can talk about it more. So mental health issues, it is a real concern when child is nowhere, she doesn't know how to react with it, can't express everything like an adult. So I have a big question mark about that part. In terms of formal education, again, this particular chunk, it is difficult to manage in terms of syllabus, heavy contents, and many of these children will in between will go through the adolescence period. And for them, schooling closer, schooling disruption might be a major disruption in their social life and the other things as well. After this, I have highlighted this already in my chapter. I would request all the audience who are present here, or the participants, to go through the chapter, and I can share the chapter individually if someone is interested. Next part, what I started doing, as Professor Sina was talking about different kinds of school, you can see this is from the DICE data itself, and this DICE data is from 1920. This data is showing different kinds of school. This categorization of type A, B, C, I have done it. We have done it during this chapter writing for our own purpose. I'll talk about it a little bit later. This is the school management. We have already created different kinds of schools where you can see Department of Education, local body, more or less like Panchayat, municipal schools, those are also running. There are government aided schools. And if you look at these three types of schools, these are one particular kind of school which is completely getting funded by the state education department, or the and also the teachers are recruited as per the government norms. Next, I am coming to the tribal welfare department, social welfare department, Ministry of Labor, JNV kind of school, which are having different kind of character, which are more or less residential schools serving specific children for a social purpose, and that is around 3.24%. You can see the majority of the schools are kind of a type of school which is coming under government of Department of Education, local body, or government aided. Third category, which is here, you can see Kendriya Vidyalaya, Sainik School, etc., which again, just now Professor Sina was talking about, that specific people who are government servants, mainly serving the children of specific people in the government service. These are the category of schools which are government managed, and they are a separate kind of, like KGVB is there. So these are particular type of schools which are made for central government employees, and so on and so forth, sometimes army people, etc. Next part is madrasa recognized, which I have kept it isolated kind of area. Uh, sorry, it is unnecessary, it is moving. Yeah. um After D, you can see this E category. It is private unaided schools, which are recognized schools, and these are around 22% schools are private unaided schools. And finally, those are unrecognized schools, which are as per Udice data. These are only 2% around. So majority of the school, you can see it is here, 71% of the schools. It is in terms of the number of schools. Now let us see what is the kind of enrollment as per Udice data. So next, I'll just show you quickly the kind of enrollment as per Udice data again. And it is little bit old data, because 2019-20, after that there is no Udice data available as of now. And you can see that majority of the enrolled children are again here. 57% are enrolled here as per the official data in type A school, and type E, which is private unaided schools, that is 37%. Now we can be very happy to see, yes, private schools are more, and therefore there are a lot of online teaching going on, and majority of the children are probably getting that kind of online, which is also not true.
And remaining part of these schools, if you look at it, because of the character of the schools, many schools couldn't operate, especially the tribal welfare department schools, social welfare department schools. These are residential schools. They had to completely close their hostels, and children actually went back. And in many areas, as per my understanding from especially Bastar region, there are lot of tribal welfare department schools which are in the conflict areas, where the children are coming from. Even the teachers also don't know. So therefore, when they go back, whether they will again come back when the schools will reopen, that remains like a big question. On the other hand, where they are located, if the teachers don't know, even if they want to connect with them, it is probably next to impossible for many of the teachers. And most of the teachers in those schools are coming from outside context. They are not the local teachers at all. So given this kind of situation, I was just thinking, then who is getting the online education? And if we are so, happy to know that there are online education, ICT, etc., some state governments are taking some initiative. Let me show you another interesting data that what is the percentage, and largely if we uh, understand that this 37% there is a possibility, let us see who are the possible people getting the online education. So out of these 37% children who are enrolled in private unaided schools, 70% of families in India, it is also from Central Square Foundation's data of 2020, that 70% of families in India pay less than 1,000 rupees per month in course fees in private unaided schools. So you can understand that if you are paying less than 1,000 rupees, it is very unlikely that they can pay well to the school teachers, and they can pay well for their online kind of education and giving training for that. It is quite costly, and we are not in that kind of position. All of a sudden we are not so prepared that we can give it to the teachers all of a sudden. Second part, which was another concern, and these are also mentioned in my chapter, only 15.7% of families pay more than 1,500 rupees per month as course fees. So we couldn't do a kind of primary survey during that point of time, but quickly I was connected with a few of my ex-students who are running their own schools, and also a few of the private schools who are in touch with me. So I started having an understanding that what is the monthly cost which is with the schools. And my co-author Roshan was also with the school, and therefore we could understand that what is the monthly cost which goes into the school, and school can be prepared for this with lot of effort. It is not so easy also for the, even for the private schools to get ready for the online education until the school already has a given very nice infrastructure. So many of the schools were not ready. Many of the schools were half ready. Many schools actually started doing something offline come online. And some of the schools I know personally, even in Karnataka, they were doing some video records, audio records, as Sarah was also talking about. The teachers were putting a lot of efforts, and those kinds of some examples, good practices you can see to keep the children busy, to keep them intact with the formal education system was happening. But if you look at these data, I was later calculating that not more than even 15% probably maximum, if you look at KV, JNV kind of things. And KV actually continued their online education, and most of the things were happening in KV because of their alumni association. Their alumni association in KV is mostly very strong. They are across the world, and alumni people, I have seen 2-3 KVs, they immediately put up some effort for giving some mobile devices, to give some access to some video records, etc., etc. And therefore they started doing something for the children, even those who are not able to afford. So I'll complete in another 2-3 minutes, 2 minutes time maybe. After that, we started doing a kind of situation analysis, that if there's a disruption of schooling, and this part is with the help of program theory, we say that if there is a main problem, what are the causes and what are the consequences? And given the causes, we could see the causes, and most of us know about the causes, etc. Then I was thinking that there might be some areas where we can highlight. These are the 3 areas we highlighted, where we can put some effort, but it will be a long kind of planning which is required. And on the other hand, I was really concerned about the consequences of this kind of disruption in schooling, and ultimately we'll get into this increased learning gap and increased dropout. And our Ajuntaji Foundation also has come up with a complete report about the increased learning gap. But when we are talking about all these things, it will not actually get into any kind of solution immediately. I was therefore thinking of what is the remedy to bring the children back to the normal rhythm. One might be reducing the syllabus. We should not think about what was there and what is the standard process. Probably we can think of these areas. Reintegration of the dropout children, and in these kinds of situations, many children who are already in the labor kind of work, if you want to bring them back to the formal education, it will not be so easy. Probably this is the time we should start thinking about the vocational education and giving that a particular kind of connotation. We have a vocational education connotation in a very different way, which is not the right thing to do. Probably vocational education we should emphasize, and NEP is talking about it. I don't know what is going to happen with that. And finally, admission to age appropriate class should be negotiated. We should think about it, whether age appropriate class is important at this point of time, or children's mental health, children's formal education continuation is more important. So I'll stop here, and I would like you to go through the chapter, and if any suggestions, any comments, I would be happy to take those comments and suggestions. And finally, I just want to show you something which I like, although it is not a part of this chapter. I like that in Japanese art there is something called kintsugi, which is for the resilience building, which is to join, if anything, any bowl is cracked, they fill it with the gold. And can we fill the things with the gold? That was the kind of understanding, kind of thought I had. But this is completely philosophical. The ground reality is really very pathetic, and I am really concerned about it. Thank you for your patience while listening to me, and I'll be open for any question, any comment. Thank you all.
Yeah, thank you. Yeah, thank you, Dr. Saswati, for this presentation. I would, ask the audience to defer the questions to the end, because I believe Dr. Saswati will be available to the end, and then we can have a holistic discussion around education and health. Anything, Dr. Indranil, you have any quick points to add or anything you want to add?
No, I'm just had a question. So I'll ask later on. No problem.
Yeah, sure. Thank you. So, this brings us to our third speaker of the evening. We have, the only medical doctor, I believe, among all the PhD doctors who I know, I later when I say PhD doctor create patients and the medical doctors treat them. So we have Dr. Sabana Rose Chaudhary, who is a public health specialist. She's an independent public health researcher and practitioner. She is an MBBS doctor from Calcutta National Medical College, University of Calcutta. Also has a diploma in maternity and child welfare from All India Institute of Hygiene and Public Health, West Bengal University of Health Sciences. She is a master in public health and PhD from JNU. She was a former researcher consultant, Institute of Economic Growth, University of Delhi, IEG, and a consultant public health, child health in the NIPI, that is Norway Indian Partnership Initiative with United Nations Office for Project Services. As a public health consultant, she has provided technical assistance to Department of Health and Family Welfare, Government of West Bengal, for establishing sick newborn care units in the districts of West Bengal. She is a fellow of Royal Society of Public Health UK, as one of our important accolades she has to her credit. Over to Dr. Sabana.
Thank you, Dr. Hipu and all others for making me a part of this August gathering. And I've been listening from morning, and it has been a wonderful learning experience from me. So I have gone through a few of the chapters in the book, and all of them are very well written and bring in very different insights into this pandemic from each one's different perspective. So to begin with, the COVID pandemic has not only exposed the basic cracks in our health system, but it has also demonstrated how much health is wealth to a nation. So when we talk about health, I will always emphasize that health we cannot see in isolation. Health is always dependent on other variables, and health moves up or down depending on these health variables. And not only these variables, but when we talk about health, the healthcare system, the health system in a holistic manner. So if we have an improved health system, it builds in the human capital, which contributes to the economic development and overall human development for a nation. So when I was going through one of the chapters by Dr. Shomodipto Chattopadhyay, he talks in his chapter, he talks about the infrastructure challenges and the human capitals. So when I was reading, I was trying to link it with my own health understanding during the pandemic times. We all in the last 2 years have been flooded with whether when we call up anyone up, or whether in any social media, any popular media of SMS, that is the social or the physical distancing, the mask, wearing of mask, and also the sanitization, the hand washing. So he talks about hand washing and sanitization, and it is basically a luxury in a country like India, where access to water and hand washing and proper sanitization measure is actually not luxury, not only in the rural parts, but many of the urban regions in the country. When in the last 2 years, I will be talking about my experience as a physician, as a public health practitioner. So when I was dealing with patients, I was dealing with community as a large of awareness and also as treating them. I was coming out that when I talked it like wash your hands, make have a physical distance, wear masks, but this is a very difficult task, because not only there are households where they don't have access to water, regular water or a 24 water supply, but in most part of different regions of our country and also West Bengal, our groundwater storage capacities has gone down tremendously. I don't know how much of you are aware of. So that makes a very difficult things when we talk about hand washing, sanitation, and also COVID appropriate behavior. So when we are in this chapter, he talks about the household and how they live. So when I still remember one of my patients asking me that the government is telling us to have a duri. So they were all migrant laborers. They were workers. They used to live in a small 100 square feet house. And when this lockdown happened, they said that that there is no ventilation. We all go out for work. But now if we go out, the police beats us up. And even the doctors and every single person we come across are talking about that, like we should maintain this physical distance, we do this and that. So how he was literally asking for a solution. So sometimes we come up with policies and a lot of, we give an advisory, which of course there should be, these advisories should be there. I'm not talking that there shouldn't be hand washing and people should not wear masks and they should not keep a physical distance. But when on the other hand, if people are unable to do it, the government and the administration should look into these loopholes, because as a health practitioners, we advise certain things, but it's like one prescription cannot suit all our patients. So when a policy is prescribed for a nation, for a region, it's the same thing. It has to be dependent and has to look into the issues. What is the locality? What is the culture? What is the practice? What is the availability? What is the accessibility to certain things which they point out? And then the policy should be built. So it cannot be a one prescription which fits for all in the country or the nation. So in this context, when we talk about isolation, everybody who had COVID was advised isolation, or people who were suspected cases, or people who were traveling were put through quarantine. Not that everybody could afford quarantine, like one of the former speakers had mentioned. that is absolutely true. Another thing about isolation, and both for isolation and quarantine, that it creates, apart from other economic issues, the financial issues or the feasibility, it creates a lot of mental health trauma. Suppose a patient, we used to come across patients when they are already in a panic state that they were COVID-19 positive. Furthermore, when we were subjected them to an isolation, maybe the first wave, people were sent to hospitals because the infrastructure was still good enough to cater to the number of patients. But in the second wave, just the health infrastructure was overwhelmed due to the sheer number of cases we had. So at that time, from mild to moderate cases, we were also treating at home. In our average household, I'm not talking about the low income or people living in the rural area or in the slum areas. In an average middle class household, even in Bengal, I came across when, there was this advisory by the government that the washrooms, the toilets should be separate, the rooms should be separate, it should be ventilated, and so on and so forth. And there should be a caregiver, there should be this. From the advisory point of view, it was perfect. It was the ideal thing we should actually do. But always the ideal thing which an advisory talks about and a ground level reality is very different. So there were times we had to move out and we had to tell patients, okay, you can, because there was no bed in the hospital. And at one time also, there were patients who were not willing to go to the hospital because these were not normal situations. They know that whether if we go and get admitted in the hospitals, we will not be allowed to talk with our family members cannot meet us. And suppose an untoward incident happens, then what happens? And this created a lot of mental trauma. So in isolation itself caused up a lot of mental health issues. And mental health issues, let me tell you, these are not something very, very visible. And these are issues which touched the lives of each one of us, whether we were frontline workers, we were as patients, as small children, elderlies, everyone is, and slowly these issues are being visible in the health sectors. And we will be, and when Shashwati was talking about school closures and lockdown, she also mentioned about mental health. That is definitely there. Not only about the dropouts, the children who are, she's talking about the dropouts or the children who cannot have regular classes. But on the other hand, we have a set of children who are doing online classes. They are subjected to gadgets. They are subjected to their, one of my eye friend specialists was saying that soon we will have a pandemic of ophthalmological issues, and it will be not for far side, it will be for the near side, because all the children, maybe they are not watching, everybody is not watching cartoon on their mobiles and doing maybe, but because the sheer number of hours of classes they are doing online. And school, I always feel like health is not only a place of learning, it's a place of social development. Like the definition of health, which we talk about, it talks about that health is a complete state of social, mental, and physical well-being, and not merely the absence of any disease or infirmity. So here, when we talk about unemployment, labor issues, migration, school closure, they all fall under the social categories, which has a by and large an impact on health. There is a paper by Dr. Hippu and Dr. and Shoidul. They also talk about the non-COVID human healthcare. They talk about, they have done their study in Murshidabad, which is one of the backward districts of West Bengal. But whatever is the picture they have highlighted in the pandemic, like, they say that in one part you have, it is there that firstly, the people thought that it will, the COVID-19 was a disease of the rich, but slowly it changed. So it's not only what is a disease, whatever the ills of this pandemic, it touched each layer, each strata of the society in different ways, in different levels, with perspective to health. So he was in that paper, they have mentioned about the triple burden of women's development and women gender issues. Gender poverty, they talk about that unemployment, etc. But along with this, women and children by and large had to bear the brunt of this pandemic, because not only poverty, unemployment, but due to this unemployment and their work going away, and they were holed up in their household, nutrition status had tremendously gone down. Malnutrition is up on the rise. Also, women trafficking, domestic violence. These all are very, by and large, has a very tremendous impact on health of an individual, not an individual. If there is a domestic violence, it's not an individual, a family is affected. Sometimes a whole community or an area is also affected by it. So, and the impacts of these things, when we talk about that prevention is better than cure. So of course, prevention is better than cure, and 80% of the diseases which we have, mostly the non-communicable diseases in the country, can be prevented. But when we talk about health, education, etc., water, sanitization, if we have a proper water supply, drinking water supply, proper sanitation, proper housing, proper nutrition, access given to individuals, given to families, then it takes care of 80% of our disease. We are talking, everybody is talking about vaccines. Vaccines were created a much uproar. I am a very pro-vaccine person. It's not that I have anything to do with against vaccination. I believe in vaccination. But what happened in this pandemic of the vaccine? One was the existing vaccine supply, the 0 to 5 years, which our children get. The other, according to the national immunization schedule, it was majorly hit. Like my previous speakers, especially Professor Sinha, was talking about what we had built over years. In these 2 years, we saw a major slide when talking from a health point of view. So, you know, this health change behaviors don't change overnight. We need to build each, whether it's a school going behavior, whether a health seeking behavior, or it's any kind of practice which needs to be changed for a better health of an individual. It doesn't happen overnight. So over several decades, healthcare workers had developed a good rapport, a good system, overcoming different challenges and burden to have a good, like a proper vaccination for the under 5 children, and also for the pregnant and lactating mothers. There are several vaccinations which requires to be given. But what happened during the first lockdown, every essential service, they talked about essential services, but the essential service during the first lockdown was only purely COVID-centric. As if health at that moment meant only COVID, as if health did not mean other diseases, the other communicable diseases, the other non-communicable disease, as if health did not have under their umbrella the under 5 children, the pregnant ladies, the cancer patients, the HIV patients, the leprosy patients, or the tuberculosis patient, or by and large malnutrition or undernutrition, to be precise, as a part of this system. So what happened? No service pertaining to these, the public, I'm talking about the public provisions made by government. India has a wonderful infrastructure in terms of pen and paper of a universal public healthcare system. I again repeat, it's such a wonderful three-layer, three-tier structure. But and if it was functioning properly, according to the theories and the policies written and envisioned for it, then pandemic would have we would have no problem dealing with the pandemic. But what we saw, that all other essential services pertaining to health were stopped, and that we had a major backlog of a lot of children not receiving their immunization, pregnant ladies not taken care of. And right now, just a few months, not even a few months, a month back, a report came that our maternal mortality ratio has increased. And even to the surprise of the state I belong to, that has also tremendously increased. And that is all an impact of this pandemic, which we had over the last 2 years. So, and furthermore, the resources, we were very less, and the main issue was a lack of a proper infrastructure and also human resources for dealing with this kind of level of pandemic. The government justified saying that the nationwide lockdown was to develop an infrastructure to deal with this pandemic. But what is not developed over years and not functioning properly cannot be just developed over a few months to cater to a pandemic. And pandemic is not an isolated issue. If we had this whole healthcare system running and functioning properly, then it not only takes care of this COVID-19 pandemic. And COVID-19 pandemic is not only the only pandemic we might be seeing. In near futures, there will be much more, there will be different diseases, the non-communicable diseases, which will be flaring up. We can see a resurgence of the neglected tropical diseases, and also a lot of diseases which had taken a back seat has now again coming up in the front. We are seeing during the pandemic also what happened, that diseases, common diseases, the seasonal diseases like malaria, dengue, chikungunya, in pockets and other places were not taken care of. And we had patients who had a double diseases, triple diseases, like they had malaria, they had dengue, they had typhoid, they had also COVID-19. So it was a total puzzle. And just imagine a patient, they are thinking they are having COVID-19 and we can see the other. And government had introduced telemedicine, which we had thankfully, which we could cater to a lot more patients, because it was not possible to treat patients individually at one point of time during the second wave. And the communities were coming up with their innovations, their supplies, and their ways of helping. So it's like I always say, it's pandemic taught us, but it is to be always there. This hand-holding and integrated approach, a community-based approach from the community to the facility. There should be always be a continuum of care, and where we can see that all the diseases, whether it's a pandemic or a non-pandemic or a lean period of no such epidemics happening in the country, the whole services can be provided from a newborn to the elderly. So in this pandemic, there were not only the shortage of trained, efficient staff, but what we saw that other staff from other essential services, other departments were pulled to cater to COVID patients. We had developed COVID hospitals later on, which run functionally. But one lesson from the past, we had the government of West Bengal. There was an outbreak of Nipah virus in the south. And during that, following a national advisory, the government of West Bengal had developed a few isolation rooms and cubicles in our infectious disease hospital in Kolkata. And that was, though never Nipah virus patients came, but when the pandemic struck Kolkata and West Bengal for the first time, those were the cubicles which were used for isolation. And like most of you will know that Infectious Disease Hospital of Belghata had done a wonderful job under the leadership of very, very young dynamic doctors who had come up with a lot of innovative ideas to work to fight this pandemic, and we learned our lessons. And another more thing which we had done, which was done with us, that all the health practitioners leaving around their specialty had worked for the COVID-19 pandemic, treating COVID patients, because we knew that the less we have the proportion of health workers to the number of patients or to the number of population is very small. So each one of us came out, and this was motivated by our organizations and also the government. The government of West Bengal at that time did a very good job. Every Sunday we used to have this 3 hours of training, because this COVID-19 was new to each one of us, whether we were specialists or general practitioners, or we were gynecologists or ENT doctors. Each evening it was open for all, whether they were government doctors or private practitioners, and that learning lessons. We had also several sessions of non-medical persons telling us how to deal with certain other issues. So I will end by saying that health should never be treated as an isolated chapter or an isolated issues, whether they are unemployment, whether they are labor issues, whether there is migration, trafficking, whether there are dropouts from school. Each has by and large an effect on health, whether it's a person's physical health or a mental health. Thank you.
Thank you, Dr. Sabana, for such a talk on giving the sort of the both as a doctor's first account in terms of dealing with this crisis, and we all must congratulate the doctor community the way they came forward bravely to fight this crisis, which was almost like a life and death situation for them as well. So of course, Dr. Sabana brought out the kind of holistic aspect of the health when she spoke about. It's not about only about the physical aspect; it's also about psychological and social aspect of health. And so of course she did quote from our book, like where we did mention that the disease doesn't distinguish between the rich and the poor, but the treatment or the the response to the disease is something which distinguishes the haves and the have-nots. So that's what clearly came out in the book, and that's the first-hand experiences what she had and her colleagues must have experienced during the time what she narrated in her talk. So we will take up the questions again in the end. This leads me to introduce our last speaker of the evening, Professor Mahalia Chatterjee, who is at the Department of Economics, Calcutta University. So she, after graduating from St. Xavier's College with the honors in economics, did her post-graduation and doctorate from Calcutta University with a specialization in urban and regional economics. She was also the director of Center for Urban Economic Studies of the same organization from 2010 to 17. And during that period, she had headed the postgraduate department for economics for a couple of years. She was a member and the chairperson of the undergraduate board of studies in economics of Calcutta University from 2007 for 10 years. Involved in urban research and teaching for almost quarter of a century. She has 2 books to her credit and a number of articles in national and international journals and edited volumes as well. She was also involved in preparing a plan document for Howrah as a part of DFID funded project of Government of West Bengal, which also I believe has led to an edited book on socio-economic perspective of Howrah, the twin city of Kolkata. She has guided a number of dissertations of MPhil and doctoral level, MPhil as well as doctoral level. She also contributes regularly in popular media, particularly in Bengali newspapers and journals. Over to Professor Mahalia, please.
Good evening, everybody. Thanks for that nice introduction. Actually, it is a privilege to talk at the last and also a problem, because most of the thing I planned to say has already been said. Anyway, I was asked to talk about urban amenities, basic amenities. Now, there is an excellent chapter by Shomudeep, which covers most of the aspects of urban amenities and which were required for combating this COVID thing. So I will not go into details of that article. Shomudeep has covered three important aspects. One is the water, availability of water, because hand washing was one of the ways thought about preventing this this particular disease. And then social distancing, that then he also taken into account the question of latrine and separate bathroom. And finally, he has talked about the housing issue. These are the things Shomudeep very competently covered in his article. I want to go to a deeper aspect of okay, pandemic has come, etc. I'm not going into that. But to start with, that is, there is a close relationship between this so-called availability of infrastructure and the supply of amenities. Infrastructure is a hard thing. Without the infrastructure, you cannot supply the amenities. That is well known. But infrastructure does not grow overnight. So for infrastructure, you need the so-called long-term planning to run the amenities, to the day-to-day things. You need good urban management. And of course, long-term planning takes us another question, that is the question of finance, of infrastructure, construction of infrastructure, maintenance of and repair of infrastructure, etc. That part has also been touched by Shomudeep in his article. Now, it does not require to repeat that urban infrastructure in India is inadequate in every sense. In every sense, it is inadequate. You talk about water, you talk about sewage and drainage, you talk about other things. It is inadequate. It is inadequate. It varies across the inadequacy varies across the states, across the urban hierarchy. That is, there is huge difference between the metropolitan cities and the smaller towns and others. Not to talk about the lowest in the rung. And then, of course, across different types of cities. Different types of cities, the planned cities, they have a better infrastructure compared to the unplanned and other things going on cities and so on. Now, let me take us to a larger issue of urban planning in general and the supply of amenities and others. Now, at one time, there was a long debate about this planning of infrastructure and other things. And there was two issues. One is about the technology, that should we go on improving technology, should we go on borrowing technology for the urban areas for the supply of infrastructure and amenities, or we would go by a demand-driven approach, that is not copying or borrowing from the other countries or other states. Rather than, we could go for a demand-driven approach, and there should be people participation in urban planning. Rather than it's a top-down thing, we should go up bottom-up. That will save our money, that will provide the right thing at the right place, and so on. In fact, the 74th Constitutional Amendment was one of the step forward for going into this, because that talked about district level planning committee, that talked about metropolitan level planning committee, that talked about ward level committees and others, and so on. Now, but in reality, say after almost 30 years, what we are seeing, that has hardly happened. The three parts of the 74th Amendment, the first one is about the people's participation, the election and the other things. Yes, that is happening. Even the political parties who opposed it at the beginning, they also found that is a way to go to the grassroots to reach the people. So nobody is opposed to a municipal election or anything. The second part, that is the Municipal Finance Commission. Yes, Shomudeep touched in it, the financial aspect of the municipalities, the financial capabilities of the municipalities, what is the way out, whether the land valorization and other things and public private partnership would lead us to better infrastructure or anything others, but etc. But anyway, we have seen that that the states regularly appoint state finance commission, but also this is a question that whether the funds allocated by the state finance commission do reach the municipalities or the urban local bodies at the lowest level. Then, but the third part, that is the planning part, which talks about the constitution of metropolitan planning committee, district planning committee where there is no metropolis, the ward committees, area committees, and so on. That part is totally neglected. Totally neglected. You cannot show me a single state where these things have actually operated or not. So that whether it is technology or it is people participation for a demand-driven question of infrastructure supply and amenities supply remains a big question. Whether we are really willing to have this type of urban planning to save our money, to put the, as I have said, to put the right thing in the right place. But what the pandemic has showed us, yes, we did not have adequate water supply, adequate access to water for most of the people. Everything is all right. We do not have separate toilet. As my previous speaker has said, that when you are talking about isolation, when you are talking about physical distancing, sometimes when people live in very congested rooms, there is high congestion in the, especially in the lower income settlements. The question of isolation or question of quarantining somebody in a separate room is something like a daydream. But India survived despite such infrastructure. Why or how? Why or how? Now, Hippo in his article on Murshidabad that said that that COVID is an article of the is a disease of the rich. It was brought by the rich. It was within the rich. But of course, it did affect the lower income group also. But we did not see any sort of pandemic or that type of death in any of the slum areas. It was in Dharavi could manage. I have some first-hand experience with Kolkata slums. Kolkata slums, again, there is hierarchy about the slums. The so-called registered slums, notified slums, they are better compared to the unregistered jhopris or others. But whatever I have, or whatever my first-hand experience in the slums, what I saw, that the slum people, their community feeling was much better. They knew that they have to make themselves safe. They have to survive in this situation. So at least in 50 slums in Kolkata, which I visited with the Paschim Banga Bosti Unnayan Samiti, they showed that they managed to keep at least a bucket of water and a piece of soap at the entry of the slum, at the entry point of the slum. And they make it a point with meetings taking into account every resident of the basti, women, children, etc. That you have to wash your hand whenever you enter the basti. That was a very good experience for me, because at that time both in the first wave and the second wave, there were newspaper clippings that the COVID pandemic has struck the middle class and upper middle class more. In Kolkata, the cases were more in the housing societies. Compared to that, the slums were safe because of their community feeling and their community participation. I waited there, say, for 3 hours in the evening, and I saw nobody is not abiding by that rule that they have to wash their hands. So they could manage with whatever water supply they had. Whatever water supply they had, they made it a point that they would do it. They would do it. Anyway, that shows that if we have people participation, then even the deficient infrastructure could also be managed. Then my last point would be, I would not make my list very long. This is a long day. All of you are hearing from 11 in the morning, so I would not make it very long. But the last point I am trying to make, that what would be the way forward? Should we rethink? Should we rethink our ideas about urban planning? Should we the things which are going on, like the smart city planning and others, that is dependent on technology. I am not blaming technology. If you can afford technology, if people can have access to the technology, it's all right. But apart from technology, should we not rethink about the people's participation part? People's participation part in urban planning in all the cities. Then finally, I would like to take your attention to another point, that till now we talk about urban planning. We talk about urban planning, we talk about housing, we talk about everything. One cannot be separated from the other. But the main thing which we fail to neglect, and still now we do not have a proper urban land policy. A proper urban land policy. So whenever we talk about, we have seen that most of our slum improvement programs from the very beginning have failed because we do not have any urban land policy. NSSO data has shown that now the new slums are coming up in private land rather than public land, because public land is now almost shrank in most of the bigger cities. So the new Jhuggi Jhopris type of unregistered slums are coming up in private land. So these people, they settle there knowing that the fears of their being thrown out are more because there are private land. The private landowner can always do that. He can always say, this is my private land, you just go out. So the insecurity, even with the insecurity, slums are growing up in private land. And whenever you have seen that in Rajiv Awas Yojana, one of the conditionalities of improvement under Rajiv Awas Yojana was that the land title should have been clear. I have experiences in some municipalities in and around Kolkata that the private landowner took it as a chance to wipe out the basti, wipe out the slum, and apartments have come up on that land. That is, it just boomerang. Rather than basti improvement, the basti people are there. Basti improvement people are thrown up, and now new apartments are turning there. So that has not happened in Kolkata, because in Kolkata most of the bastis are till now protected by the Thika Tenancy Act. So ejection is not so. But taking India as a whole, India's urban as a whole, what we need now is a very comprehensive urban land policy. That infrastructure will not grow in the sky. We need land. We need land. If we talk about the thing which has come up during the pandemic with the return journey of the migrant, is the affordable rental housing. Now, where would this housing would be if we don't have any proper land policy? Policy for the land. Again, if we build this affordable rental housing, quote unquote, in lands which are far away from their working place, again that policy will fail. So the need of the day is to supply, to build up infrastructure, to supply proper amenities. We should think about the first thing, that is land, and we need a comprehensive urban land policy. Let me end here. Again, thanks with the organizers for asking me to share my thoughts in this workshop. Thank you.
Many thanks to Professor Mahalia. And without, I think, further wait, let me invite questions. Let me start with Professor Indraneem, who had a question earlier. So, Professor Indraneem.
Okay, this is probably on education. I think it's for Dr. Pite, and this is, so far I've understood you have, lastly, you have advocated for vocational education. Now, I'm just curious, how does vocational education can be juxtaposed against, the new education policy? Because so far I understand new education policy, do they actually want to promote the vocational education?
Thank you, Nirmal, for the question. Yes, in the new education policy, there is a particular area which is highlighting that vocational education should be emphasized again. Even in the previous education policies, vocational education was talked about. In Kothari Commission report also talked about it. But so far, what happened in vocational education, nothing has been progressed much. When it is a vocational education, it is also in terms of the connotation itself, that the people who can't do anything in the mainstream academics, they go for vocational education, ITI kind of things, right? So what is happening during this pandemic, I have seen that a lot of children who are in the verge of adolescence kind of, because of the family pressure, they were into some kind of works. And now when they will come back to the school, it will be very difficult for them to get adjusted with a formal education when they are in the 9th, 10th grade. When they have jumped from the 7th grade to 9th or 10th grade, it will not be easy. At the same time, if they fail and if they drop out, what will happen? So they are already having a muscle power, and they will feel that I am frustrated because of certain things happen to me, and because of that I am not responsible, right? So for these kind of set of children who are coming back after 2 years, and at the same time in the adolescent, or just completed the adolescence time, and they don't have anything actually to do when they are coming back to school and fail in terms of the formal education system. I was thinking that why can't we emphasize on vocational education in a different manner, saying that if you are doing something by hands-on experience kind of thing, any kind of industrial level things, or some kind of courses, as in the NEP 2020, it is also talking about vocational education. How they are going to execute it is not very clear. So I was thinking this is the high time, probably we should emphasize on that, saying that you have not lost anything. You have lost probably 2 years of your academic years, but you can still come back to your mainstream education through some other channel. And if we can channelize these people, I feel a lot of social unrest which is going to happen in a few years time. Already it has started happening, like in between the privileged versus underprivileged, there will be huge tussle which will start happening. I think through vocational education, if we can engage these children, saying that there is a future for them as well, for that matter, probably government should start thinking about more institutions where they can get a chance, where they can do some skill building, and they can get into some kind of job market later part. Because after post this pandemic, I'm seeing that social unrest followed by unemployment, and the kind of other kinds of disbalance in between privileged versus underprivileged, that is bothering me. That's why I picked up that vocational education. I was going through that vocational education part, but I was not very clear what in NEP is going to do until unless NEP start its execution. I'm not sure what is there, or it will be lying like the same thing which happened in the previous education policies. That's where I'm coming from. Yeah.
Thank you.
Thank you, Dr. Saraswati. We have a question from Dr. Surajit. Please go ahead.
Thanks. I have two questions. One to Shashwati. That is, I was wondering that, commonsensically, it is understandable that because of this online teaching thing and online education thing, not only at school level, but also at college, university level, we all are experiencing that those who are from remote places, as compared to the cities, big cities, they are being deprived. Then those who are from poorer section of population rather than richer section of population, they are being deprived. They don't have their own laptops or computers maybe. Then if there are more than one student in a family, then the girl children would be deprived probably, and the boy children would get if they have simultaneous classes. So all these things now, because of and there is this class caste nexus also in our country. So naturally, these divides, regional divides, class divides, caste divides, gender divides would increase. I mean, degree of that would probably increase because of this online teaching mode. I mean, number one is the quality is suffering. Number two is quality is not suffering equally for everybody. It is suffering in differential manner. So that way divides would go up. And since he was talking about your problem of the whole generation. So I would like to know, since you work at the ground level, I don't have much exposure in this area. Do you really think that these gaps are actually going to widen because of online education? And we don't have much option. That's a different debate altogether. Again, probably schools are getting closed and there is a fear of another wave and so on. So what is your opinion about these things? That is one. Second is to Professor Mahalia Chatterjee. Ma'am, I come from West Bengal, so I have some sentiment for West Bengal. But I have worked, ma'am, are you there, ma'am? Professor
Sir,
Chatterjee, are you?
I'm here. I'm here.
Okay, okay, ma'am. I have done some work for Kerala. In fact, I used to work in Kerala State Planning Board earlier, and last year also I was doing a project for their local bodies. They have 1,200 local bodies, and they have a fantastic. We were talking about 73rd and 74th amendments of the Constitution, and Kerala. I mean, irrespective of the political color, I mean, there was a history of People's Plan campaign, of course, in late 90s in Kerala, but both LDF government as well as UDF government, they are equally serious about implementing this decentralization process in Kerala. As compared to then in West Bengal, I have seen neither left was serious nor this present government is serious about decentralization. I mean, election wise, yes, but as you are rightly pointing out that in financial, in terms of financial autonomy and other things, decentralization is not happening. But we all realize the importance of decentralization and local level planning. So what are the real constants? I mean, how to make it happen in West Bengal? That's my question.
Should I go first with the answer?
Yes, yes, please go ahead.
Okay, so Surajit, thanks for your question. I can give you quickly an example. Yes, the gap is widened already, and it is not widened, as you said, and we have all experienced that online teaching is not so effective when it is coming to college and university as well. But what happens, that main difference is that in college and university, the students have their choice to some extent, that they are coming with a choice. But without 10th or 12th grade passing, you can't get into the college education or university education at all. So that is the basic things to get into even the college and university education. Some of my students were also in a very bad state at that point of time. I was telling them over the phone that what will maximum happen, you will have to lose 1 year because of this one online education, and probably that will not affect that much. If you come back after 1 year, probably you can continue, although it extended for almost 1.5 years for our online education. But one way I can think of that, at least for the adults, definitely there is a loss, but at least there is a kind of thing they can rationalize things. For the children, they are completely dependent on the parents, and once there is a problem in the house, their education will be first thing which will be definitely cut off, because that is an extended expansion. So what happened, I can give a quick example. In Telangana, there are 2 children, and I was working closely with some of my students during this pandemic for the education of the children, and some of my students are going to the field, talking to these children in group of 5, 6, sometimes over the phone, sometimes offline. So these 2 children, we found that they are girl children and were extremely in a very bad condition. Somehow we managed to give them some education through their private school where they were studying earlier. And finally, private school agreed to take them, although they had a gap of 1 year. We requested them, and we raised fund, etc. What happened in the same colony, I'm telling you, another 30 children who couldn't get this opportunity, because these two children were known to me through someone else. Now another 30 children who are deprived for last 2 years, they started bullying them in the locality because they are getting the education. You can imagine what will happen to these children. What started happening recently, it is very recent development, that is not formally, I have not said anywhere, but we have started thinking of schooling of these 30 children, because in that particular locality, government schools are just not running. Children are going to the school sometimes, but there is no class happening. Officially school is open, teachers are not coming,
and only for sometimes for the midday meal they are opening the school. That is the kind of scenario right now. So for these 2 children, we had to start thinking for the remaining 30 children in that colony, and that is a huge task. Now we are around 7-8 people working on that particular project, which is completely parallel to my university work. And that is the right now I can see that what may happen when there are children who are getting this, and at the same time some children are not getting that. And this is a widening the gap in terms of many things, not only formal education. Kind of frustration you can see that one child is of 10 years and the child of 10 years getting education and not getting education, and when they are into 15 or 16 years old, you can see the kind of differences in terms of their own mentality. And you have got it because you are coming from certain background and all this. Just to save that in particular locality, we have to expand it like that. So that is a quick example, and there are multiple examples, I am for sure, because my students keep on telling me that what to do. I really don't know what to do, but widening gap is enormous. I can't imagine what is happening, especially the areas I work there. I can't imagine any online education there. There is no electricity, first of all. Forget about online education. There is no electricity. So even with a phone, you have to charge it, right? So forget about internship, this internet, etc. But your phone needs to be charged. That is also not possible. Only for 2-3 hours, sometimes they get the electricity in that locality. So I don't know. Probably I don't have any proper answer, but yes, widening the gap is definitely there. Yeah.
Thank you. May I request Professor Mahalia to respond to Dr.
Yes.
Subhadeep?
Yes, Kerala is always, whenever we talked about decentralized planning or anything, Kerala is always an exception. West Bengal, West Bengal was the first one. In fact, 73rd and 74th Amendment was on on West Bengal's model. West Bengal models of 3-tier things and others. But that were all history. I don't know whether you have experience or not, but this is the first time when the ULB elections happened under the left-run government in 1982. That was after the first time that the budgetary allocations went much ahead, and there was a municipal finance commission appointed by West Bengal government in 1982 to 83 under the chairmanship of Professor Bhavatos Dotto. So there were attempts in West Bengal during the left front rule to decentralize, not only decentralize the so-called power structure, but also devolution of funds and others. Whether they are successful or not, that is a different question. But again, things got changed in the last 15 years of left front rule. But nowadays, nobody talks about, nobody knows what decentralization means in West Bengal in every level, because decision is taken by only one person, and that's all. That's all. But what is good that in West Bengal, what we have seen during the pandemic, that lots and lots of NGOs and others, and even political parties came out with their plans for protection against pandemic and others. So that is a sort of democratic spirit we have seen, despite the singular control of a singular party at every level. That much I can say. Anyway, time will show that whether it has happened or not. It's very difficult to say at this point only that what will happen to decentralization in West Bengal. But of course, there were attempts for decentralization at different level. I, being a student of Professor Ashim Das Gupta, in his each and every class, he taught us about decentralization at say early 80s or so. So there were attempts, but the actual evaluation was never done. Whether it is, that is one of the, what should I say, one of the drawbacks of the left-hand government. That they never wanted any proper, what I say, utilization of what they're doing.
Thank you, madam. Thank you.
Thank you. Yeah. Thank you, Professor Mahalia. So Dr. Saswati has raised her hand. So do you have anything to ask to any of your co-panelists?
So I just have one small question to Dr. Shabana. So there are a lot of drug-related information in the WhatsApp during this pandemic, and it was at some point of time it was so random, and some this drug is important, this drug to be taken, etc. What is the role of the doctors at that point of time related to this kind of viral information on the drugs?
At that time, let me tell you, we did not have the luxury of time to even think. We were also learning, but the things we had to deal with, because we had patients coming up with, they had already started using some drug which it was discussed in the social media or the other newspaper, or maybe a panel discussion in the televisions. So at that point, we kept on counseling them, but like there was this huge nexus of pharmaceutical companies, the drug dealers, and the other things, and the administration basically failed to curtail this overuse or misuse of drugs. Moment a drug was named in the protocol, or moment a drug was discussed that this was showing some good results, immediately it used to go off the shelf. Even the basic drugs which we use for the treatment of COVID. Everyone will talk about that COVID treatment required a lot of, out-of-pocket expenditures and etc. But over the last 2 years of learning, and even during the second wave, the government of West Bengal had a proper protocol to treat, and most of the patients, if they had followed what the doctors said and what were the advisories and the counseling given by the doctors, then they really did not have to go anywhere and stock and hold. They're like, in between we were talking about remdesivir, but nobody left it to the doctors to decide whether a remdesivir is required for a patient. We had these discussions in other non-medical groups. People said, like, people have stocked up remdesivir, and remdesivir is not a cheap drug, and it is not to be used. Even during the third wave, there was this cocktail drugs and the other things, these therapies, who to give, who not to give, as if the community was deciding. This health-seeking behavior saw very rapid changes, and like we see for other diseases also, that like as if people say, like they would just say, আমি তো কিনতে পারবো না, তো আমি কি মরে যাবো, like I will die because I cannot afford those drugs. But so as not only as practitioners we were treating, but we were constantly that burden of hours and hours of counseling, that you will not die, and those with cheap drugs also you can be treated, or sometimes no drugs were also required for certain group of patients. That is one part for COVID patients. And when we talk about drugs, sometimes very essential regular medications for chronic diseases like hypertension, diabetes, these were also not available in the shops. So this supply of drugs and essential drug and medical equipments is always necessity. It's not only during pandemic, and all of you must be aware of that recently all our essential drugs, the price has gone up by many fold. Thank you. Hope I was clear, Dr. Shashi.
Thank you.
Thank you, Dr. Sabana. Professor Indrani, I think you have something to add.
Yeah, the last thing I'm sorry, I just got the question is to Dr. Chaudhary, and that is see, I think in your talk you somewhere talked about that the treatment, COVID treatment could be different for different regions, right? If I have got it correctly, right? I mean, did that you mean, or and if it is that you meant, then I mean, you said probably that it can be context specific, it can be changed from one region to another. Did that you mean? And if it is so, then are there any examples of that?
No, what I really meant, it was not for COVID treatment, but in general treatment when we give a patient. like for COVID, we had different states had different COVID protocol of treatment. Let me tell you. So which each thereof the state experts, the health experts thought that is so not what we were using a drug called doxycycline. Some other states were not using that because maybe our health expert has their rationale to use. So, and when we have these set protocols, the protocols in case of these unprecedented health circumstances, we are supposed to follow the protocol, which we had by and large, most of us had done it. But there were times when we had to deviate from the protocol, thinking that this first is accessibility, affordability, and also maybe the patient doesn't require those drugs. And if it was available from the public sector, like the government hospitals were overwhelmed. They were doing triaging, that whoever did not require testing, they were not. It's not that when we talk about testing and reporting, along with our it is a part of a treatment or a management protocol. So, like in the government hospitals, they were based on symptoms and signs. They were setting a certain number of people for testing and certain number of people for not testing. So there was a lot of hue and cry saying that the government wants to suppress the numbers. That's why they are doing it. But suppressing number is one issue. Data mishandling and data interpretation is another issue. But the doctors there were not really doing to suppress the data. If I have a system of testing for 100 people in a day, I cannot send 10,000 people to that system to testing. So I have to use my discretion, my clinical acumen, my judgment skill as a physician to see who I will send and who requires it, and whoever not requires it. They were writing medicines. Basically, this COVID-19 is a type of a viral flu, but it causes a lot of changes in the system in different way, which is not the general flus which we have throughout the years. So, but it was the discretion of the doctors. So when, like the patients also, whenever whoever's for required for testing, they also decided who will do the test in the household and who will not do the household. Because if एक positive होगा तो सबाई positive हो जाते. Something like this, and the fear of isolation, and also the amount of money a household, the entire has to shell out for doing this test. So in that sense, I was saying that policy, I was talking about basically policy prescriptions. Whether it's for health or anything, when we make a policy, by and large, the policies come from the central government for all our health programs. Then the state also implements it. But what I meant to say, these health programs, these health policy prescriptions, which are there in pen and paper, each state, each district, maybe each district, some blocks will again behave very differently, or their needs and demands might be very different. So what I said that there must be a structure, but it should be constantly changed and adapted at the local level to gain the maximum benefit or the purpose for which the policy is made. Hope I'm clear, Dr. Indoni.
Yeah. Thank you so much.
Thank you.
Thank you. I mean, I'm seeing there is no more questions. So, I mean, this is as a moderator, I have the honor and the pleasure to thank all my panelists. And since morning, as we have been listening, I mean, you have ended in a very good note where most of the points what we are saying since morning, like for example, Professor Santosh Mehrotra did speak about how we are spending much less, even compared to certain low-income countries in India in terms of our health budget. And Professor Sachidanand also mentioned about how our education expenditure is also very low. And somewhere, also, I think all our panelists here in this session did agree that we should have policy, be it about health, education, or even urban policy. We should have greater participation and decentralization of local specific interventions. So I hope all of us who stayed late and those of us who participated also partially in this workshop have got something out of this workshop. And I will again have the honor and the pleasure of again showing the book. which on behalf of all the authors and the editors, I request that you can get this book in the Amazon and other platforms, and you can get it from the library as Dr. initially suggested because of its cost factor at this edition. Once probably, as I understand about publications, when a book like this gets more accepted, then paperback edition or Indian edition might come on the publisher decides to have so. So with this, let me invite our editorial, one of our co-editors, Dr. Kingsuk Sarkar, to deliver the vote of thanks. Dr. Kingsuk, yes, you are there.
Thank you, Dr. Ripu. So, like conducting the session in a nice fashion, and kind of also you have kind of given the end notes also, like we had a long day today, but very meaningful and fruitful discussion. So I will not detain people for long, and so I will deliver the formal vote of thanks. First of all, I would like to like to thank all the audience first, all those who are attendees. Like it will be difficult to take all the names, but all those who have took time of their busy schedule and attended the sessions and enriched the session through asking questions, and also seeking clarification on certain things, and also expressing their opinions, have kind of enriched these proceedings. And I also like to thank all the panelists in all the 3 sessions that we had, starting from Professor Ravi Srivastrava, then Professor Sebastian Morris, and also Sri Shampat Kumar, who joined from US, and also Professor Santosh Mehrotra. They addressed this conference, this webinar on book release, and they took out time from their busy schedule and be with us. We are grateful to all of them. And also in the session 2, we had Shoykot Sinarai, Professor Shoykot Sinarai from Jadavpur University, Sri Partha Pratim Mitra, ex-principal labor and employment advisor, Government of India, Professor Jogesh Joshi from Sardar Patel University, Professor Surajit Das from JNU. And in the 3rd session, we had Professor Chachananda Sinha, Professor JNU, Professor Mahalia Chatterjee, Professor University of Calcutta, Professor Shashwati Paik, Ajim Premji University, and Professor Shabana Chowdhury from public health, who is a public health specialist. Our sincere thanks to all of you, because you took time from your busy schedule, and also you added a lot of dimensions to the proceedings, and we thank all the people who are involved in the IRMA, because they hosted this. I must mention the name of Shibangsh Mishra, Manager Communication IRMA, who has this is an online webinar, and because of his and his team efforts that we can ultimately we could hold this webinar. And also our thanks to Director IRMA for being the patron of this book release webinar and national workshop on COVID-19 pandemic, public policy and institutions, issues of labor, income and human development. And I'm also sincerely expressing my thanks to all my co-editors, Professor Indranil De, Professor Hipu, Professor Shomudip, all of you made a huge effort for the last many months, and first of all to come up with the books, and then conceptualizing this workshop, and constantly working towards the success of this. I think at the end of the day, all of us worked together hard, and we had a very meaningful discussion today, and a lot of new dimensions come up, which may provide food for thought for future work. Thank you very much. Thank you all. If I forget to mention anybody's name, my apologies for that. Thank you very much.